Time now for our Pets and People column here on Island Morning. And recently in this series, we've been looking at issues facing pets as they age and advice for owners on keeping pets healthy. And I continued that conversation with veterinarian Marty Hobson. Hello again, Marty.
Hello.
Thanks so much for coming in. And last time you were here, you told us about the thyroid gland in dogs, and you brought your buddy Jake in, and Jake's back with us today, but I don't know if Jake should cover his ears because today we're talking about cats, right?
Yeah, he lives with two of them, so he's used to their mysterious ways.
And you were saying cats and dogs have different problems, right, with this?
Yeah, if you recall, we were talking about the thyroid gland, which is a really important gland in your neck. It's a pair of glands on either side of your trachea, your windpipe, shaped like a little shield, or some people think it looks like a butterfly. And cats get the opposite problem to dogs. They develop hyperthyroidism.
Not hypo.
Exactly. So hyper is from the Greek word for over, so an overproduction of thyroid hormone.
And that's what's happening. Is it the thyroid is just producing too much?
That's right. And it's also a disease of older cats. We've been talking about problems that older animals suffer from. And the average age is around 13 years, and it's really pretty common. And the cause is just an overgrowth of the thyroid. It's a benign growth, similar to a benign cancer. And the growth itself isn't dangerous, but the effects of all that extra thyroid hormone can be really debilitating.
And when we were talking about dogs, you talked about the low energy associated with low metabolism. So is this then the opposite of that?
Yeah, we see all signs of increased metabolism. The body's engine that we talked about is really revved up and it's using a lot of fuel.
What signs would you see?
So the hallmark for hyperthyroidism is weight loss despite having a good appetite. So you might have an overweight cat that's a bit older that loses weight really quickly, even though you haven't put it on a diet, or even has a ravenous appetite, but it's still losing weight. And they also can be more thirsty and could have vomiting and diarrhea. And you also can see increased energy, like a cat sort of zooming around and, seeing those invisible demons that no one else can detect in the corners of the ceiling. You also may see behavioral changes like irritability. They also don't feel very well. So yeah, they can be cranky and also maybe not grooming themselves as much.
Do we know why this happens? Why this disease occurs?
Not really, Matt. We know there's probably a role in genetics. And interesting, I was reading there's a correlation between eating canned cat food from a certain type of can. It's those short little pop-top cans, with the little tab that you pull. And those cans are lined with a substance that can leach into the fats and oils of the cat food. But keep in mind that there's lots of cats that do get high thyroid levels that have never eaten canned food in their life. And there's lots of really good reasons to feed older cats canned food because of the increased moisture so they can stay hydrated. So I don't want people to get scared and take their cats off canned food. But there have been studies that have implicated those cans, as well as other household chemicals like flame retardants that we used to see in children's clothing and other substances.
But still a bit of a mystery here. And how is it diagnosed? Is it a blood test?
Yeah, it's the same blood test for dogs. And so, like I said last time, we recommend that any senior pet, and I would say that's over 7 years or so, they should have regular blood work at the time of your checkup with your veterinarian. There's lots of abnormalities that can be picked up really early before there are signs, and so those things can be treated. So for hyperthyroidism, sometimes it's very clear. Other times it's not so clear, and we do this neat thing called a radioactive scan. That's really only at bigger centers where this special diagnostic is available. They're given a little bit of a radioactive material and then scanned, kind of like an X-ray, and the thyroid glands, they just light up really bright. The pictures of it are really interesting because that thyroid gland is using more of the material and picking it up.
Is this easy to manage as well?
Yeah, but the interesting thing is there are more options and choices for the cats that have hyperthyroidism. So they can take medication. That's called methimazole, and that suppresses the production of the thyroid glands. And so that would be for the life of the cat, just like we were talking about medication for dogs. And you'd have to come back every 3 to 6 months and monitor levels. Cats, as you know, are not as easy to pill compared to dogs. And so for some people, depending on the relationship with the cat, they don't enjoy this. You can even have that methimazole, though, compounded into a liquid, and it even can be made into a gel that is rubbed on the ears. And studies have shown that that can be an effective way to administer that medication. It just absorbs through the skin. Another thing we can do is surgery on the thyroid gland and just remove it. But you can imagine the cats are very small, and there's a lot of stuff, going on in the neck, like those jugular veins and other big vessels. So it's not really an easy surgery, and the cat can have some complications afterwards. And at the very least, we'll probably have to start giving thyroid hormone once we take the thyroid out. And there's also a really neat new special diet. So the thyroid uses iodine to make the hormone. So there's a special diet called YD. It's a dry food made by Hills. And that diet has no iodine. So if you're really strict and your cat gets no other food and no other treats, the theory is that then the thyroid won't be able to make as much of that hormone that's causing the problems.
And there's a radioactive therapy as well?
Yeah, this is really neat. Again, it's done in a special facility, and the cat is given radioactive iodine. So as I mentioned, the thyroid takes up that iodine and tries to make it into the hormone. But just like a person having radiation, this radioactive iodine destroys the thyroid cells, so the problem can go away. These facilities are kind of interesting because once the cat gets the injection, it's just one injection, but then they're kind of hot. They're radioactive for like 7 days afterwards, and it doesn't really cause any long-standing harm to the cat, but they have to stay in that facility in special kennels for 7 days. They can't just go home. And the staff of the facility can go in and change the litter box and feed them, but they can't really spend time with them. So they've really done a lot with these facilities. Often they have televisions that are playing like kitty channels, you know, like birds chirping and things like that on the VCRs, like these little monitors for the cats, and windows maybe where they can look outside. And they even often have webcams so that the owners can check in on their cats.
Well,
like
7 days is a long time, sure.
I know. It's hard. But once that 7-day process is finished, the cat, if everything went well, should be okay. That is a fix rather than a management strategy. It certainly is pretty expensive. And again, we don't have any facility like this on PEI, but there are facilities that do this in Nova Scotia and New Brunswick.
So Islanders do have an option.
Yeah, and your veterinarian would be able to refer you to one of those.
I appreciate this, Marty. Thanks a lot for coming in.
You're very welcome.
Marty Hobson, and our thanks to Marty and to the Companion Animal Welfare Initiative for helping with our Pets and People column here on Island Morning.